basically the mechanism of injury, so like she was saying, is if you get hit on the front of the knee with the knee in extension like this, you're more likely to injure the anterior cruciate. But if the knee is bent like this and you get hit here, it's going to push the tibia which way? Posterior, right? Or if you fall like this, so if I fell like this onto the tibia, and then the tibia gets pushed posterior, that's going to tear the PCL. Or also, like she said, if you're sitting in a car and your dashboard, head-on collision or something, the dashboard gets pushed, it hits right here, and it pushes the tibia posterior in relation to the femur. That's going to affect the PCL. And then you can see on here the meniscus. So this is looking down onto the tibia. And then this bone on this side here is which bone? This one here, right? So the fibula. So you know that's on the lateral side. And then this is anterior. So this is the tibial tuberosity, so we know that's the front of the femur, or the tibia, I'm sorry. And then here's the fibula. And so then that's where you can see the medial meniscus is shaped more like a C, and the lateral meniscus is shaped more like an O. So usually the mnemonic to remember it is so the medial meniscus is shaped like a C, the lateral meniscus is shaped like an O. And you don't really have to worry about knowing this screw home mechanism of the knee, okay? But it's just, I'm just showing it here so you'd be aware of it. And it's because the surface of the femoral condyle is longer on the medial side than it is on the lateral side. So when the knee is moving, it has that screw home mechanism. So as it fully extends, that medial side is going to slide a little bit farther. Okay? So you can make a note in there that you don't need to worry about knowing this for this class, okay? But so that later on when you hear about that screw home mechanism, it has to do with, as I extend my knee like this, the last bit, what do we call that again? What kind of extension is that? Terminal extension? Right. So terminal extension, it moves a little bit farther like that. Okay, so that's the screw home mechanism. As that tibia is fully extending, it kind of does that a little bit. Right. So like I said, you don't need to worry about knowing that for this class, but this, at least you're exposed to it here. Okay. And then we'll talk about joints, and we talk about two different positions of a joint. We'll talk about either a close pack or a loose pack position. Okay. Close pack means that the two articular surfaces are in maximum congruency, where they're jammed up against each other, and also the ligaments are tightened up as much as they can be. Okay? So usually we'll talk about that in terms of the larger joints of the body, like in the shoulders, the hips, the knees. Okay? So in the shoulder, if your shoulder's in this position, see how it feels, if your shoulder feels loose or if the ligaments are tight or not, and then compare that to this position. Okay, how does it feel in this position compared to this? Which one feels tighter in your shoulder? Like this, right? Okay. Here is more of a loose pack position. Borrow your arm. See, if the shoulder's like this, you can move it around in different directions like that. You don't have any problems with that shoulder, do you? Okay, so if I come back like that, you can feel that tighten up, right? It's tightening up the ligaments. It's shoving the articular surfaces in congruency with each other. Okay? And then in the knee, if I'm extended like this, that's going to be the close pack position of the knee. Okay? Versus loose pack. Technically, loose pack means anything other than close pack. But usually in some of the joints, there is a specific position that's considered a loose pack position. Okay? And so when we talk about doing tests for the ligaments of the knee, you're going to have it in a loose pack position, which is a little bit slightly flexed like that. Okay? And then maybe if we have time, we can show you some of the tests for the ligaments of the knee. and they're usually done in the loose pack position. Okay. And the thing is that joints are going to be more likely to be injured when they're in a close pack position. Okay. If your arm is up like this and then somebody pulls on your shoulder, you're going to be more likely to get injured versus if your shoulder's in this position. Okay. Also, if I'm standing like this and my knees are locked and somebody hits me from the side, my knee's going to bend, it's going to pop, right? If I'm like this, I can move, right? You get impacted from the side, you have a little bit more give to it. So it's like when people are doing martial arts or boxing or something, or playing tennis or whatever, you get more like in this kind of a position, right? So you're able to move better. And if you got hit and your knees were bent like that, you can give a little bit more. Whereas if your knee's like that and it's locked, your ligaments are going to pop. Right? So that's what I'm saying. Like if somebody gets hit on the front of the knee, they're going to tear their anterior cruciate. And a lot of times the medial collateral ligament and the medial meniscus. Because one thing about the two ligaments on the knee, the medial meniscus is closer to the knee joint and it's attached to the medial meniscus, versus the lateral collateral ligament is farther away from the knee joint because you got the fibula sticking out there. So we had to actually come down a little bit bigger. Okay, so here, the medial collateral ligament right there, versus on the lateral side, it's farther away from the joint because of the fibula right there. Okay, so that fibula collateral is not as close to the knee as the medial collateral. So that's why a lot of times you have what's called the terrible triad in the knee, where you have three things that get injured. You get the medial collateral ligament, anterior cruciate, and medial meniscus. All right, and then talking about injuries to the knee, in orthopedics, usually you divide things into what's called inert tissue and contractile tissue, and then also nerve tissue and then vascular. Okay, so inert tissue is going to be things that don't move, or they can't contract on their own. So it's going to be things like bones, ligaments, cartilage, bursa, joint capsules, things like that. So usually injuries to those tissues are going to happen from an acute traumatic incident, right? You break your bone, you twist your ankle and you sprain your ligament, you get hit in the knee, tear a ligament, things like that. Versus if you have contractile tissues, those are going to be what? What contracts? Muscles, right? And then what attach muscles to bone? Tendons. So contractile tissue injuries are going to be injuries of muscle and or their attachments. So like a tendon, or also where that tendon attaches to the bone. Does anybody ever have shin splints? Ever heard of that? Okay, shin splints, what that is it's where the muscle actually attaches to the bone. Okay, and do you slip and fall and all of a sudden, oh, I got a shin splint? How does it happen? More repetitive. Okay, so contractile tissue injuries are usually going to be more repetitive types of things, right? You have tendinitis, things like that, stress fractures. So contractile tissues are usually things that are more repetitive. Okay? Does that mean you can't all of a sudden just rupture your tendon like that? No, that can happen. You can get, anybody heard of Achilles tendon ruptures, biceps tendon ruptures? So you can have an acute injury, but sometimes those are going to be building up over time. Or as somebody gets older, their tissues, again, they kind of dry out, they're not as resilient. Somebody's like a weekend warrior person, all of a sudden they're playing tennis and they zig when they should have zagged and they blow out their Achilles tendon. Okay, so then we talk about different types of injuries. If you injure a ligament, what do you call that? Sprain, right? Okay. And if you tear a muscle, what's that called? Strain. Okay. So you want to make sure you understand the difference to those two terms. Okay. But just